So I'm on slide 12. So a couple of other benefits of accreditation. We don't doubt through our studies that accreditation promotes positive quality and safety cultures across organizational boundaries. In other words, if you think about an organization and accreditation comes along with standards, with surveyors, with a process that puts you under the spotlight and makes you think about quality and safety, that tends to generate a positive culture that may not be there if you didn't have accreditation, as you rightly say. That probably wouldn't just happen accidentally or because the organization suddenly got it into their head that they would try and abide by standards. So there's something about having an accreditation process organized with an accreditation agency and standards and surveyors that probably leads to positive cultures around quality improvement consistently across the health system. And as you say, it's doubtful that people would just do this all of them themselves without having that mechanism, that stimulus. So the next point is accreditation, therefore, can be used to create and build quality and safety improvements. And look, I'm being a bit controversial here because, well, I am sort of tending towards that way, a bit sort of challenging, but I don't believe that model exists. Maybe for some organisations, they're at the margins, but I think most people do use accreditation in this way to try and improve continuously over time. I think there's a continuous improvement gradient in health systems that have accreditation and keep on improving accreditation. What are you going to? Well, what standards are you going to? Version 3. And so that's a real indicator that there's an appetite for improvement and continuous improvement. Next thing is we've done a couple of trials. You mentioned short notice surveys. We've done a couple of trials. They're in the literature. One on short notice surveys, unannounced surveys they were called at first, but now they're called short notice, where you don't get to know the surveyors are coming in 6 months' time. And the other one looking at the patient journey within organisations, not across the whole system the way you're planning, but patient journeys within the system. And both of those have real benefits in an accreditation system in our judgment, in the judgment of our trial. So we've published those in the literature. So if you're planning on doing that or looking at it, our study and a few other studies probably point out that that's a useful thing to think about doing. They're useful options in an accreditation scheme. Because one of the problems with accreditation, say, in terms of the patient journey is accreditation as it stands, as we've been discussing this morning, accreditation tends to say, what are the standards like within an institution, within an organisation? But actually, patients have a much more complicated relationship with the health system, don't they? You go to a general practitioner several times, then you then go to a specialist, then you go back to the general practitioner, you do some community-based, you receive some community-based care. It's sort of, in a way, just assessing the standards against an organisation doesn't really map to the real experience of patients across the system longitudinally. And I know you're looking at that, and I would applaud that. I think that's a very wise thing to do. I think it's a very wise thing to have a look at that.
Talking about the patient journey survey, one experience we have is that the method has great appeal both to surveyors and to institutions. But when surveyors actually use the method or think they use the method, what happens is that they do take the survey process out of the meeting rooms and into the settings where the frontline staff are. But they rarely, in our experience at least, take the next step and actually follow the patient journey through the institution. They tend to go to one ward and ask them a lot of questions about what are you doing, and then go to another ward and ask them similar questions.
Yeah. Yeah.
Did you find something?
Can't remember the details.
No.
Yeah, yeah. It's an interesting point, though.
Yeah.
So if you're looking at our work studies like that, by the way, and you've got any questions, feel free to sort of email us, or we could Skype or whatever, you know. You can tweet me. You can look me up on Facebook. You can email me. I have a website and a mobile phone number. Am I going to get 35 calls this afternoon, maybe? Yes. Just remember, if you do call me, I might be asleep. So I'm on page 14. The other bit of the equation, the other bit of the sort of puzzle for running good accreditation programs is the surveyor workforce. And making sure that surveyors survey in a reliable way, that they're well trained, that they're developed as a cohort of surveyors. What, were you saying that you have 50? 50 in the workforce? Yes. Yeah, 50 surveyors. So having the accreditation agency really work with those surveyors, develop them over time, have them understand the standards really well, assess consistently and reliably against the standards, regardless of which organisation they go to. The other bit of the equation for us that we've noticed, and Accreditation Canada is a good example of this, is really building the cohort of surveyors because they have very valuable knowledge. They learn a lot about the health system. So the surveyor goes from their own organisation to survey other organisations. And in Australia, we've got people who've done a couple of 100 surveys across their career. So they're very knowledgeable about the Australian health system. And that's really valuable knowledge for the health system. They are extremely knowledgeable people about what's happening in healthcare. Probably some of the most knowledgeable people in the country because they do so many surveys across time. And so we are constantly trying to find a way to unlock the knowledge of those surveyors because they know a lot about the health system and what works and what doesn't. We also know that those surveyors, and somebody's done a PhD with me on this, those surveyors then go back to their own organisation and they really understand about what works and what doesn't in another context. And so their own organisation, if they're wise, can use that information and it's very valuable. So I went to a conference last year with Wendy Nicklin, who's the CEO of Accreditation Canada, and we were talking about surveyors as being ambassadors. You know that notion of ambassadors? And I think it's a really strong, you probably use that too, the notion that your accreditation surveyors are very valuable people and they are ambassadors for ECAS and the accreditation process. So choosing them wisely, having good ones, having ones that are fair and consistently assessing organisations against the criteria and the indicators and the standards becomes a very important part of your accreditation process. I'm on 15 now. And over the years, there hasn't been a good evidence base for accreditation, and we haven't done studies on what it means to apply standards, and we haven't done studies to see if the model is more like this than this. We haven't done that very well. Accreditation really started to be done in the world rather than have a good evidence base for it. We guessed that this was a good thing to do. I think it was a good guess, it was a good bet, but we didn't know for sure. And as I say, sometimes I wear a hat that says, I'm a scientist. I need to know if we're doing good things, not just I need to feel that we're doing good things. So over time, we've tried to add to that evidence base. We've certainly have. We've done a lot of studies, as you can see. You may have already known that before I came. But I think really looking at the evidence base for accreditation is something now that's being done much more often. And you see, as I go around the world now, I see, accreditation agencies like ECAS have master's students and PhD students who are doing research on the accreditation mechanisms to try and understand and doing big studies. So here's more of our papers.